Numerous persons who suffer from seizures seek medical care at the Georgetown Public Hospital, and of those cases, several are as a result of epilepsy. This is a disorder of the brain characterized by repeated seizures and is caused by a temporary change in the electrical functioning of the brain. The brain, a major organ, is responsible for all motor functions. Each year on February 12th, International Epilepsy Day is observed in efforts to raise awareness of this condition. Dr. Alex Prasad, a neurology specialist at the hospital, on Monday said it is important that people know of the condition and its signs.
Persons would have a recurrent or enduring predisposition to have epilepsy or have epileptic seizure rather. So usually persons that will have more than one epileptic seizure that are unprovoked, separated by a period of 24 hours, or if somebody has just one seizure, with a high chance of having it again within the next 10 years.
Part of the hospital's efforts to raise awareness is through informing patients and their families who visit the hospital. On Monday, there was an information desk set up at the hospital to provoke conversations around the topic. There are several signs and precautions to take when a person is experiencing a seizure. Dr. Prasad said the seizure must be timed, and if 5 minutes pass before the seizure stops, that person needs to be rushed to an emergency room. But while the seizure is occurring, persons are advised not to place restraints on the person and not to put anything into the person's mouth. Instead, put them into a safety position and cushion their head. Remove all harmful objects from within their reach and stay with them. Dr. Sophia David Long, a doctor attached at the hospital's neurology department, said persons must pay attention to the medication and food they ingest that might cause reactions leading to epileptic seizures.
Treatment for epilepsy, like in any other illness, we have both pharmacological medications that we're given. We have popular medications like Dilantin, carbamazepine, which is known as Tegretol, we have Keppra. But it's good to remember that one medication doesn't work for everyone and for all, and that these medications are tailored depending on the patient. There are other conditions, and of course the women if those patients are pregnant or of childbearing age.
A pregnant epileptic patient is considered a high risk and will be monitored and is encouraged to stay hydrated and rest to reduce the high risk of seizures. The Georgetown Public Hospital currently has clinic days on Wednesdays for persons who suffer from seizures. The doctors said these patients include children as young as 6 months old who are tended to by the pediatric department. Reporting for the newsroom, Lazina Yearwood.